workers who are on the front line dealing with the public that, by definition, by the nature of their work, they have to violate the social distance and maybe expose themselves and their families to greater risk. We also have with us Gary Nguyen from Clinic 360 in the audience. Thank you to Clinic 360 and Gary for your work in stepping up and working with the healthcare agency in setting this up for us. This is a major operation that will deliver almost 5,000 test capability a day. And so it takes a tremendous amount of organization to get that going. So with that, Madam Chair, if you would like to invite Mayor Sidhu. And as I mentioned, the city of Anaheim is only one of the cities that have really been working with us real closely in setting up this program. And as we continue through this program in the future, we see other locations around the county as well. So this is just a starting point. And I want to thank the cities, and particularly Anaheim and Santa Ana, for just being so collaborative and really extending yourself and being very immersed in the planning process for the county to be able to roll out this program and then be the first host for it. So thank you, Mayor Sidhu. Go ahead, Mayor. Okay.
Oh, yes, thank you. Indeed, it's been a pleasure working with Supervisor Doe. We have a synergy that we developed. We have a lot more work to do, and it'll be a pleasure to continue working with you. I'm thrilled that we have our partners, Clinic 360, in the city of Anaheim, have today to celebrate what is our first large-scale testing site in Orange County. I would join with Supervisor Doe in thanking Mayor Sidhu in helping to make the community center open for us at no cost. That's a fabulous way to help us get things done. And to the Clinic 360 for doing the work that will be there. We couldn't have done this without the talent of all those who work for the Anaheim Convention Center and the city of Anaheim. So I thank all of you who may be involved in that effort. It's really great because we're going to be able to do a lot of really good things together. You understand there's been a considerable amount of frustration in the community regarding testing. In fact, Governor Newsom mentioned the testing sites need to be bolstered across the state. And Orange County is doing its part to assist in this regard, and this is a major step toward that goal. As you know, some residents may be frustrated they cannot get tested at a site because they do not meet the criteria. We're looking for symptomatic people at this time, as well as healthcare workers and those that are essential. There are many sites across the county where they can go. The list may be found on the HCA website and ochealthinformation.com/novel coronavirus. We understand there's a wait, and we're doing our best to help build this further capacity and make the wait shorter. Once again, I want to thank the mayor, the city of Anaheim, and Clinic 360 for their efforts in this regard. And I would ask Chairwoman Steele if you have any comments you'd care to make.
Mayor Sidhu, thank you very much. Could you come up? Without your help, I mean, this is the first driving inside, right? So thank you for the partnership.
Thank you so much. Madam Chair Steele and supervisors, as Orange County's largest city, Anaheim is meeting the challenge of coronavirus. With our community partners, we have provided food relief for tens of thousands of seniors and families in our city. We are providing rent help to working families and grants to struggling small businesses. Now we are working with the county to bring more resources to our city. With your help and outreach, and mobile testing is coming this week to areas of Anaheim that has seen the highest number of cases. And now, Anaheim is helping to lead the largest expansion of testing in Orange County. No other Orange County city has the space and skills to make this happen on this scale. Anaheim is proud to be our part. Testing has been available across Anaheim, but this expansion will open it up to many more. This will help us address a surge of cases in our community and across Orange County. It will allow us to get back to reopening safely when the time is right. But stopping the spread of coronavirus takes more than just testing. And while there is a critical role for government, it takes more than government. It takes everyone. And we need everyone to do their part. The more we do now, the quicker we will get through this. I want to thank the board, OC Health, for bringing more testing to Anaheim. Thank you to 360 Healthcare for stepping up and providing this testing. And I want to thank everyone at my Anaheim Convention Center, Anaheim Police Department, Anaheim Fire and Rescue, for making it possible for our residents and those across Orange County to get tested safely in our city. And I want to thank again.
Thank you, Mayor. Vice Chair Doe.
Thank you, Madam Chair. I was going to wait until Dr. Chow come up to do his report to thank him, but I want to take this opportunity to thank Dr. Chow as well, personally, for his leadership. As soon as he took reign as Director of Healthcare Agency, this was one of the priorities for him, and to have made it happen so quickly is a testament to his leadership. For those of you who may not have had a long or as long of a working history with Dr. Chow as I have, in Dr. Chow, we have someone who is very knowledgeable, obviously, but also very well connected at all levels of healthcare decision-making in the state and at the federal level as well. And so we have a very good resource in Dr. Chow, and it shows here with this testing program that's being put together. So thank you very much, Dr. Chow.
Okay, Dr. Chow, it's your turn.
Good morning, Chairwoman Steele and honorable members of the Board of Supervisors. Thank you, Vice Chairman Doe, for your kind words. I am just I am. I'm doing my work for the community, so thank you. I think 360 Clinic, Mr. Nguyen is still here. Yes. I'm wondering if I could ask him to say a few words in this partnership, both Vice Chair Doe and Supervisor Seshie.
Sure.
Okay. Mr. Nguyen.
Thank you so much for having me here. Thank you, Dr. Chow, inviting me. This is the first time I meet you in person. Heard about you and Supervisor Andrew Doe. I heard a lot about your name. So, you know, it's very touching today. I sit in the back, and I'm very honored to be here for everyone. So, give you a quick background about me. And, you know, I want to say thank you for 360 Clinic to empower me to step forward and help the community in OC. And I appreciate my wife being there to support. So we Arizonian, we're not Californian. My background, I was a major in the Air Force, infectious disease chairman, ER all my life. Family medicine, I lead troops to Biloxi and help Katrina. And I publish paper, and help Vietnamese and Asian American. So about 8 weeks ago, when the coronavirus hit, remind me of Biloxi trip. So I, against my wife's will, I put a lot of money and jumped into helping the Asian American in Arizona. And as of today, if you look it up, you see a lot of people talking about us in Arizona. We have about 100,000 people. And the social media, they said, wow, where do you do the test? How do I get the test? Thank you so much for your help. We did it all for free. And that was a passion, really. So I picked up the phone and called Gary, and I said, Gary, I think I'm done for Arizona. Now it's just operation is continuing, and I think the Asian and OC need help. So can you step up, and help the people? I think there's a huge need in California. And I give him some statistics. I said we did for Native American, we did for Phoenix, Caucasian, we did for Asian American. Turns out Asian American has the highest rate. And I think it's from the culture of being Asian. We kind of get together and holding hand, church, temple, all of that. So we did in the church pilot, and it was shocked to see what it's like in 300 car drove through. And Gary took initiative and wanted to take on the largest operation to help people. So that's me, background, and thank you for being here. And thank you, Gary. Thank you, the team. They're over there, and we're just here to help. Thank you.
Thank you. Would you like, you want to make everybody stand, your team here?
Gary, you're the leader. Vince, Dr. Kurt Jallis, he came from Arizona. My wife from Arizona. Julie, the system IT director. She's, behind the technology, and she's here as well. And I want to say thank you for being here. And Andrew is going for medical school in San Jose, and before he go to med school, he's going to jump in and help. So thank you so much, everyone, and Gary, honor to be here. Yeah.
Thank you, Doctor.
Thank you.
Okay. Dr. Chow.
Thank you so much. As part of the testing, we will be launching a soft first day tomorrow at the Anaheim Convention Center. The team is still working on the registration site. We should be ready by this late afternoon. Molly and her team will send out a press release and direct people to the site for an enrollment. So we are very excited and looking forward to it. But I want to thank the board and Mr. Kim for pushing HCA to get this done and keeping my finger crossed for tomorrow.
How did you reach out to the community to come out?
Mr. Nguyen and I know each other from my previous work at LA Care Health Plan. He runs a medical clinic. So.
No, what I'm saying is to the community, that how they're going to come out and drive. Yeah.
So the website will direct them on how to do all the enrollment and where to go, etc.
So they have to make an appointment before
That's
they
correct.
come?
They have to enroll, yes.
How many people do you think you're going to expect tomorrow?
Well, so our previous, as you know, with the Latino Health Equity Initiative, when we rolled out the mobile testing, the appointment was filled up within 24 hours, and so we know the demand is there. So even though we will not be able to roll out the enrollment to later on today, but I expect that we'll have a fair number tomorrow, because like I said, the demand is pretty high in this county.
Thank you. So because of Mayor's help, that this happens really quick, and I really appreciate it, but you are doing it, City of Costa Mesa, how long it's going to take and when we're going to do that?
The conversation with the fairground has already started, Chairwoman, and because they are The sites are not available for the next 2 weeks. We're hoping that after 2 weeks,
Right after.
we'll be able to set that up.
Okay. Vice Chair Do?
Thank you, Madam Chair. What I heard from the chair's question is, we have the infrastructure, we have the Anaheim Convention Center, the site. What outreach are we doing in order to let people know, in order to sign up for the test? I know the sign up could be done online, but the question is, do people know about it in order to, to sign up? What effort is HCA doing to promote it? And think of the Latino Health Equity
Yes.
Initiative as an example. Are we doing something similar, maybe not quite as extensive, but something similar to the county at large to let people know about this testing capability?
Yes, there's a press release later on today when the site's ready, and then tomorrow there will be a press conference, I believe, that is set for tomorrow morning at the site.
I would
And,
encourage the healthcare agency to really reach out and maybe even talk to like radio talk show programs and disseminate this information, because sometimes people have questions. They, in the absence of knowledge, they assume it doesn't exist.
Right.
And so it's good for people to have that be on their consciousness. Even if they don't, partake in the test, the point is they know that we have that capability. So if they have a suspicion, they know they have a resource to go to.
In my report, I'll go through all that.
Okay,
We have
perfect.
planned.
Okay.
Thank you.
Great,
Vice
thank
Chair.
you.
All right. So I want to thank the testing ad hoc committee and the Board of Supervisors for your leadership during this challenging time. I'd like to begin my update today with the recent closure that the governor announced yesterday. Effective yesterday, California closed some indoor business operations statewide and additional indoor operations in county that have been on the monitoring list for 3 consecutive days, which includes Orange County, and I believe that list is now up to 30 counties. Statewide indoor closure up until yesterday include restaurant, bars and breweries, wineries, tasting room, movie theater, family entertainment center, zoo and museums, and card rooms. The newly added county indoor closure include fitness centers, places of worship, indoor protests, offices for non-critical infrastructure sectors, personal care services, hair salons, and barbershop and malls. I will be issuing an updated health officer order that captures this additional closures today. As of yesterday, Orange County is currently on the monitoring list for not meeting the disease transmission criteria, including testing positivity rate and case rate only. I'm in regular, almost daily conversation with the state person who's assigned to monitor us to ensure that we are taking appropriate actions. In addition, as of July 12, hospital capacity was at 60%, and there are currently 2 patients from Imperial County who are hospitalized in Orange County Hospital.